Okay, this is Dr. C. Nice to see you today. Thank you for joining me. I know in the past we've had a show on cholesterol, probably several years ago now, but there have been a number of different things that are going on in the whole field of cholesterol. So I thought we should revisit that again. And so here we are. Cholesterol puts fear into the hearts of a lot of people. 1 in 3 people in the United States has a high cholesterol. Well, what the heck does that mean? Should it put fear into you? Is it important? Well, the whole cholesterol theory, and it is just a theory, was kind of put into perspectives a number of decades ago. So we're going to go through the whole thing. Cholesterol itself is just what they call a sterol, S-T-E-R-O-L, a sterol. It's a fat, obviously. It's in the fat family, but it's a little different. It's a solid fat. But at any rate, it was named many, many, many years ago, and in reference to the chole, which is bile, chole, sterol, which is solid, and all, which is an alcohol. All alls are alcohols. So that's how it got its name. We make most of the cholesterol in our own liver. 80% of the cholesterol that you measure in your body, when there's roughly about 35 grams in your body, 80% comes from the liver. The other 20% comes from what you eat. So 1 gram a day is made, 1,000 milligrams a day is made in the liver, and roughly about 300 milligrams is consumed. It's consumed. So you can see that most of it is very self-determined. So at any rate, let's talk a little bit more about it. What's the function of cholesterol? It isn't all bad, Your body makes it. It's essential. What is it used for? Your cell wall. All the little cells in your body have a wall. And the wall itself, 30% of it is cholesterol. There's also other components to it, like phospholipoproteins, that type of stuff. But the cholesterol wall, very important as far as the brain goes. Roughly 25% of the cell wall is composed of cholesterol. So pretty important. It also is a precursor for a lot of the steroid hormones in our body. Now, that may sound simple, but remember, a lot of the steroid hormones are estrogen, estradiol, estrase, testosterone, cortisol, aldosterone. You're familiar with a lot of those names. For the men out there, the testosterone and the methyl testosterone, those hit the bell. You understand those. For the women, the estrogen hormones. So does decreasing cholesterol have an effect on that? Well, we'll talk about that too. Right now, we're talking about what cholesterol does in your body. It's also a component of the covering of a lot of nerve endings. For example, nerve endings have a myelin sheath. That myelin is partially composed of cholesterol as well. So obviously, cholesterol has a lot to do in your body. What else can we talk about? How do you transport it? Because remember, cholesterol, as I mentioned, is a lipid, which is a fat, and the bloodstream is a liquid, water. How do you transport all of that to the cells so they can use it for their cell wall or making hormones, etc.? Well, that has a lot to do with the lipoproteins. So when they first started the cholesterol theory and all, and that has a very shady, not shady in terms of a bad start, but shady as far as getting acceptance of this theory. A fellow by the name of Ansel Keys. He was kind of a shady character anyway, but he did what was called a 7 countries study. 7 countries. The fact that he started out looking at 22 countries and 15 of the 22 didn't meet his liking, and so he narrowed it down to countries that would prove his cholesterol theory. In other words, you eat more cholesterol, you're going to get more arteriosclerosis, you're going to get more heart attacks, strokes, etc. So that was kind of a shady deal there. Wasn't the only shady deal right at the beginning either. There was another fellow who fed rabbits. They fed rabbits cholesterol diets. And lo and behold, the rabbits, who are herbivores, they don't usually eat cholesterol foods. They developed hardening of the arteries and arteriosclerosis. Oh, fits our criteria. Well, what criteria, you idiot? You fed a herbivore cholesterol. So then they finally started to think about it a little bit, despite the fact that our wonderful NIH back in 1984 came to the conclusion that cholesterol was a major cause of cardiovascular disease. Shows you how stupid some of our people who lead us are. So at any rate, then the next big thing was statins. In 1994, statins came into account. Well, pharmaceutical houses, got right on the bandwagon. This is a big deal. We're going to reduce that cholesterol. It's going to be much, much better around here. Oh, man. And obviously, a lot of articles showed that taking a statin did decrease the cholesterol, but they never proved that by decreasing the cholesterol, you would increase your lifespan. In other words, had absolutely nothing to do with mortality. Well, it was a number. And if you decrease that number and it didn't make any difference whether you lived or died, come on. So that theory, cholesterol theory, had a lot of holes in it. But the important thing was the transport of the cholesterol. These are lipoproteins. And when you get what they call a lipid profile, this is what the doctor will order for you, a lipid profile. They will check, of course, the cholesterol. They will check other forms of the lipids as well. And they check the lipoproteins, the transport lipoproteins. So let's talk a little bit about it, because this is what brings it home for the people more, because you're getting this done, and you know, since 1 in 3 Americans have high cholesterol, maybe it's a bad thing and we need to get it down. Okay, let's talk about that lipid profile. Doctor tells you you're going to have a blood test. Okay, get your blood test done. Do I have to be fasting? Nah, we're going to it doesn't have to be fasting. Bullshit number 1. You do have to be fasting to be accurate. Why? Because when you eat something that's fat, it breaks down into triglycerides. Triglycerides then need time to get into your bloodstream, and that increases temporarily the fats in your bloodstream, including the triglycerides especially, but also the total fat. So that's you need to fast 12 hours. 12 hours. You can drink all the water you want. That isn't going to do anything. But no food, no cholesterol, no fatty foods. Okay, wonderful. Let's go on from there. What about the results now that you get from the lipoproteins that they check? And incidentally, how do the lipoproteins transport the cholesterol? Cholesterol, remember, is fat. So you need to have a shell around that fat so it can go into the bloodstream, which is water-based. That's where the lipoproteins have the phospholipids. They also, if you wanted to look up at a picture of the lipoprotein, this is the picture. And you can see around the outer shell, these are the phospholipids that are around it. These are the cholesterol that are inside of it. Now, one lipoprotein can carry a lot of cholesterol, and it carries it to the liver, carries it to the tissues where it's going to be stored, because you need the lipoproteins for energy. Yes, you do need glucose, but glucose is very limited. Glucose runs out in 12 hours if you're doing something labor intensive. So you're then burning lipids that convert to glucose. So that is the way it looks. You notice up on the top up here too. It's called an ApoB, APO, apolipoprotein. Now, what is an apolipoprotein? It's interesting. Not all of the lipoproteins that transport cholesterol have these apolipoproteins on them, or they may have other types. There's, in fact, 5 different types of apolipoproteins. The important ones for us, for cholesterol, are apolipoprotein A and B. A and B. A goes around all of the bad cholesterol, which is the low-density lipoprotein, which includes LDL, low lipoprotein, intermediate lipoprotein, and very low density lipoprotein. Low density lipoprotein. So all of those do have the ApoA, and it also has an ApoB. Now, the ApoB is important as far as testing goes, because all of the lipoproteins that are bad have apolipoprotein B, a single protein on that, a single molecule. And they can measure that apolipoprotein B, which tells you how risky is it for you to have all of this bad cholesterol, this is much more accurate than measuring low-density lipoprotein. Much more accurate. Okay, so if you, number 1, are obese, number 2, you got a big belly with a lot of abdominal fat. Number 3, you got diabetes. Number 4, you got a positive family history of heart attacks at a younger age. Those are all indications to get your apolipoprotein B checked. Okay. So now we're talking about that test, the lipid profile. So lipid profile will give you your answers. Total cholesterol should be under 200 milligram per deciliter, 200. So, and what are the other values that you're looking for? Well, the high density lipoprotein should be over 60 milligram per deciliter. The triglyceride should be 150, not over 150 milligram per deciliter. And then the ApoB, if you have it done, should be under 90 milligram per deciliter. Now, if you've had a previous heart attack or a stroke, or in other words, you have evidence of previous heart complications from arteriosclerosis, you should try to get that ApoB down under 70. Some are even pushing to get it under 55, which is not easy to do. But at any rate, those are the things that you are looking for with your lipid profile. Now, it isn't just taking medications or not taking medications. It's a whole program to reduce your cholesterol. A lot of things you can eat make the cholesterol worse. Cheese, margarine, high-fat beef, bacon, anything with like pork belly or beef belly, that type of stuff. Tater tots absorb a lot. Mac and cheese, fried fish, fried foods, bad stuff. And a lot of the high cholesterol pastries. Those are all known factors to increase your cholesterol. Diet-wise, chocolate is good to decrease it. People who also use stuff like garlic, for example. They use stuff like eggplant or oatmeal, all good stuff. Almonds are supposed to be good. Blueberries are good. Extra virgin olive oil is good. Fatty fish is good, like salmon, for example. Red wine is good because it has resveratrol as well. And so all of these things are known diet-wise to decrease cholesterol. But there's also medications, statin medications. There's high-intensity, medium-intensity, and low-intensity statins. The high-intensity statins are things like Lipitor and rosuvastatin, which generally is the strongest of all of the statins themselves. So the rosuvastatin, 20 milligrams would be indicated for high risk. For the atorvastatin, which is the Lipitor, 40 milligrams and above for high-risk patients. Okay. Moderate intensity, you can use a lower dose of those two, or even high-dose simvastatin. For a low intensity, you can use the lower dose simvastatin and other of the earlier forms like Mevacor and all of the statins. You can also now use a thing called Zetia. Zetia decreases the absorption of cholesterol in your gut. The statins themselves influence the production of cholesterol in the liver. Remember, liver produces 80% of the cholesterol. You can also use now by injection. We use the letters, really, PCSK9 inhibitors, like Repatha, for example. You get it by injection once a month at first, and then you can do it every 6 months eventually. That decreases the cholesterol by at least 60% if you use it that way. So not too bad at all. We also use things like the bile acid resins like cholestyramine, which trap the cholesterol in the gut and carry it out. Of course, remember, you're only 20% of it is through the gut. But still, the bile acid resins do work. And so do the fibrates. The fibrates do as well. People also use things like nicotinic acid, niacin. Gives a lot of people headaches, but it does reduce the cholesterol by probably 10% or so, which isn't too bad. Not too bad. The natural things are things like garlic, red yeast rice. You're familiar with a lot of these things. So All these things then are part of the program. The program. No smoking, ideal weight, exercise 150 minutes a week, taking your meds and your diet. That's the whole program. Okay. So enough about the testing part now. So why don't we go on from there? What about seniors and cholesterol? Most of the studies that were done on the cholesterol and its bad effects, most of the studies were done on people between the ages of 40 and 75. What does that say for me? I'm 86. Well, we can't say much, but we can extrapolate. Yeah, what does that mean, extrapolate? Means you're guessing as to what it does. Well, some studies now have been done on elderly people. And as long as, and I'm talking now of 75 and over, 75 and over. What about them? If they are not diabetic and they have not had previous heart problems like heart attack, congestive heart failure, or stroke, if they have not had that, you don't need a statin, period. That's enough. Because statins do have side effects. Some side effects are significant. The side effects that people talk about mostly are muscle cramps and all. But you can get severe muscle cramps, rhabdomyolysis, actually dissolution of your muscles. But because of the aches and pains in the muscles, people don't exercise as much. People feel older. Wow, significant side effects. So, elder people, remember, over 75, no diabetes, no prior heart problem, chuck those statins. Get rid of them. Get rid of them. Okay. So, that's my little thing about age-related. So, what else can we talk about? Oh, I forgot to mention, too, when you have your lipid profile done and you get your numbers, how did the lab deal with that? How did they deal with it? What do they do to test it? Well, they test and they give you an answer for the high-density lipoprotein, the so-called good cholesterol. It's not cholesterol, for Christ's sakes. It's lipoproteins. Forget the cholesterol. Forget it. Not important. So the LDL. The LDL is the important thing. And how do they measure that LDL? I told you they measure the triglycerides. They measure the high-density lipoproteins. How do they measure the LDL? They don't. It's not a direct measurement. They estimate it. And they use a thing called the Friedrich, equation. The Friedrich equation. And what the equation says is that low-density lipoproteins, and they have a little -C, cholesterol, low-density lipoprotein equals the total cholesterol. Well, what is total cholesterol? It's cholesterol, very low-density cholesterol, or very low-density lipoprotein, intermediate lipoprotein, and also the triglycerides, as I mentioned. So they use that as a measure of LDL, the low density. How accurate is that? Well, not as accurate as you may think, because there are alternatives now to try to do a more direct measurement, which costs more, obviously. The whole thing is cost. They've been using this Friedrich equation now for over 50 years. because it's quick. It's quick. Gives you an answer right away. So, at any rate, are there problems with that Friedrich equation? Yes, there are. Number one, how do you determine the very low density lipoproteins? Well, they assume that it is 1/5 of the triglycerides. They assume that. Is it always? No. In fact, if your triglycerides are over 400, they won't even do it. They won't give you an LDL measurement. If it's over 200, there are spotty problems with the results. Okay, that's number one. Number one, assuming that. Number two, I already mentioned that if it's over 400, they won't even do it. They won't even do it, actually. So, excuse me. What did I have? Oh, I'm losing my mind, but at any rate, other problems with that Friedewald equation. The assuming the 5 ratio, not a direct measurement, requires fasting of 12 hours to be accurate, does not account for any genetic problems, giving you high cholesterol, giving you high triglycerides. They don't account for your diet, which is different in different countries. And so there's a lot of issues with that test. It doesn't mean you shouldn't get it, because they're not going to do the more expensive test. Money is the only thing. That's the American way. So that is the basic criticism of your lipid profile. So I think I've basically talked probably too darn much about a topic that actually is very important for you. Because remember, at your age, you always at your age, if you're over 75, most of the testing has not been done over 75 for this and for many other of the medications that you may be on. And so you need to ask your doctor specifically, have the tests, have the trials that were done, were they done on people my age? And you might be surprised, because they may not have been. Okay, this is Dr. C. I think I've talked too much today. You have a good day. And remember all the things you need to do naturally to keep that cholesterol, or lipoproteins, I should say, intact. Bye-bye.